International Journal of Health Policy and Management. Quality and speed are our culture and the keys to our success. Welcome to the audio summary section of the International Journal of Health Policy and Management.
I'm Casswell, an alcohol policy researcher based in Aotearoa, New Zealand. I'm talking about a case study published in the International Journal of Health Policy and Management, which is about alcohol policy development in Vietnam. The case study was carried out with collaborators in Vietnam who provided copies of documents and translations, and the case study could not have been carried out without them. The analysis also drew on English language media coverage of the policy process in the decade leading up to it. The policy development took place over the years 2012 to 2019, and during this time the consumption of commercially produced beer increased dramatically, adding to the traditional beverages already available. This was a result of the opening up of the Vietnamese economy to transnational beer-producing corporations, which marketed their products without restrictions to consumers whose wealth was increasing as the Vietnamese economy grew. Over this time period, the consumption of alcohol overall in Vietnam increased by an astonishing 90%. Officials in the Vietnamese Ministry of Health, supported by the World Health Organization's local and regional offices, were well aware of the increased health risk from this growth in alcohol consumption and produced a sound, public health-oriented alcohol law in 2012. However, there were first delays in the legislation being considered, and then direct lobbying on the 6 published drafts of the policy from major global commercial players, including Heineken, Diageo, Pernod Ricard, AB InBev, from the local alcohol PR agencies and the European Chamber of Commerce. All of the recommended and often successful changes from the commercial interest weaken the regulation of supply and marketing, including removing bans on internet marketing and sponsorship. A proposal to create a health promotion agency with funding from alcohol taxes was removed early on in the process. These delays to the introduction of legislation and direct lobbying on content did not occur in a vacuum. The global commercial interests had been active in Vietnam for many years prior to the first draft of the legislation. Relationships had been built to position the commercial interests in a partnership role as part of the solution to alcohol harm. Often this was via funding of public relations activities, such as anti-drink driving campaigns and educational activities. As is commonly seen, much of the focus of discussion was on economic benefits from the alcohol industry, the implications of Vietnam's membership of trade and investment agreements used to dissuade uptake of effective policy measures, and attempts to deflect attention away from the commercial products to traditional beverages. Throughout the process, the resource available to support the health sector, which came from civil society and the World Health Organization, was much smaller than that available to the global commercial interests, which had identified Vietnam as an important growth market. Not only was there less funding available, but there was a lack of global normative support for alcohol policy, and the contrast with the trajectory of tobacco control in Vietnam illustrates the value of a legally binding treaty, the Framework Convention on Tobacco Control, which existed for tobacco. Alcohol is still waiting for a stronger global response to prevent alcohol harm. The experience in Vietnam is not unusual. Many alcohol policy processes have been strongly influenced and effective policy prevented by the efforts of the commercial interests. This case study does, however, illustrate the urgent need for a stronger global response from the global health community to reduce alcohol harm.